So renal denervation is under investigation for treatment of uncontrolled hypertension. And we have now 3 randomized sham-controlled trials that investigated renal denervation in patients who received medication, but also in patients who are not treated with concomitant antihypertensive medication. And these randomized sham-controlled trials all proved the efficacy and safety of renal denervation as applied in these studies. The technologies that were used consisted of radiofrequency energy and ultrasound. So we have now a couple of clinical studies that prove the value of renal denervation in patients with hypertension. So as said, we have now 3 randomized sham-controlled trials that have proven the efficacy and safety of renal denervation. A couple of pivotal studies are ongoing. These studies will be used to obtain approval by the Food and Drug Administration in the United States. These are bigger studies. A couple of them are ongoing. The first pivotal study is completed. That was the SPYRAL HTN-OFF MED trial, the SPYRAL HTN-OFF MED pivotal study that confirmed the efficacy of renal denervation and showed superiority of the procedure when compared to sham in patients not treated with any antihypertensive medication. Well, it is quite difficult in clinical practice to assess sympathetic nervous system activity in humans. There is no reliable tests available. We have some surrogates of sympathetic activities. These include blood pressure. The higher the blood pressure is, the greater is the fall that we typically see following renal denervation. Another measure of sympathetic activity is heart rate. And we have evidence indicating that patients with higher heart rate tend to respond better from renal denervation compared to patients with lower heart rate. And also obesity. So obese patients tend to have larger falls in blood pressure compared to lean patients. So these are all indirect surrogates of sympathetic activity. But up to date, we have not proven that a surrogate like catecholamine concentration in serum or plasma is a reliable assessment of sympathetic activity.